This is not a promotional marketing video. This video is intended for patients about to be admitted for surgery for serious gynecological conditions at Royal Surrey County Hospital. Your surgery may vary slightly and, if so, this will be outlined to you by the team when you are seen a few days prior to your surgery. At this appointment, your consent for surgery will be obtained and any of your wishes will be noted.
Hello, I'm Anil Taylor. I'm a consultant gynecologist and a cancer specialist with over 30 years of experience in the field. My expertise is in the surgical treatment of all gynecological cancers, including all womb cancers. In this video, I would like to explain what is involved in surgery for treating a womb cancer. Womb cancers are the commonest gynecological cancers that we come across and usually affect patients after the menopause, but can sometimes also affect premenopausal women. In most cases, this cancer is curable with surgery, which involves doing a hysterectomy. Some women also require some radiotherapy, and some may also have chemotherapy, although that is only in a minority. The cancer is usually diagnosed from a biopsy of the womb lining, and these patients also have a pelvic MRI scan to check whether the muscle of the womb has been affected or whether the lymph glands in the pelvis look enlarged. Enlarged lymph glands can sometimes mean that the womb cancer has spread to them. This would affect the stage of the cancer and will also mean that after the hysterectomy you will require additional treatment such as radiotherapy. I know that a diagnosis of any cancer can be very daunting, and preparing for surgery to treat it can be a big moment. I want to make sure you feel as informed and as prepared as possible for your upcoming surgery. In this video, I'll walk you through the key aspects of the operation, what we aim to achieve, and the potential risks you should be aware of. The main aim of the surgery is to remove the cancer and also take biopsies of lymph glands to check whether they have been affected with the cancer. Therefore, let us talk about how the operation will be carried out. Almost all women with a womb cancer can be successfully treated with a keyhole hysterectomy. This is better than having an open hysterectomy through a cut on the abdomen. With the keyhole approach, there is less pain, shorter recovery, and less chance of serious complications compared to open surgery. Keyhole hysterectomies are best done robotically, which is a newer and more precise way to carry it out. A senior surgeon still does the operation. The robot is merely used to control the fine instruments inside the body through small holes. The surgeon is the one controlling the robot. Let us talk about the steps involved with the operation. After you've been put to sleep, we will inject a special dye into the cervix. This dye slowly goes to the first set of lymph glands in your pelvis in the next few minutes. These lymph glands are called sentinel lymph glands. These are also the same lymph glands that will be trapping any cancer cells that have decided to travel to the lymph glands. It is therefore logical to take those lymph glands out in preference. After injecting the dye into the cervix, we will put some gas into the abdomen to create some space. We will then make 5 small holes. These are roughly the size of a shirt buttonhole. Through these holes, we will insert the fine instruments such as scissors and graspers. We will then attach these instruments to the robot, and we are then ready to start doing the hysterectomy. We will first start looking for the lymph glands, which by now will be highlighted by the dye injected earlier. From each side of the pelvis, we will remove 1 or 2 lymph glands. You have plenty of lymph glands in the pelvis and all over your body. They are involved in the immune system. Removing 1 or 2 lymph glands will not affect your immune system in any measurable way. We will then proceed to detach the ovaries, tubes, the womb and the cervix from all the attachments, and once finally detached, we will pull the specimen out through the vagina. In 90% of patients, the specimen will come out easily through the vagina. In some patients, the womb is too big or the vagina is too narrow to allow it to come through. In these cases, we will extend one of the holes already made on the tummy and extract the specimen through that cut. Therefore, this cut may now be about 2 inches in length. After the womb has been removed through the vagina, we will put a stitch at the top of the vagina where the cervix used to be. You will therefore still have an intact vagina and will be able to have intercourse normally after you have recovered in 6 weeks' time. All the stitches, including those to close the small holes on the abdomen, will be absorbable and will disappear in the next 3 to 4 weeks. This whole surgery will take 1.5 to 2 hours. During the surgery, we put in a urinary catheter, and this will either be removed before you wake up from surgery or may be removed last thing in the evening before bedtime. This operation can be done as a day case, and if you are keen to go home the same day, then we will take it out before you wake up from surgery. If you're staying in overnight, then in the morning you will have breakfast and hopefully will have been successful in emptying your bladder. The majority of women only have minor discomfort overnight and will be discharged in the morning. Vaginal bleeding is also very minimal. The specimen from the operation will be processed in the lab and the final result will be available 2 to 3 weeks later. Any decision about further treatment, such as radiotherapy or chemotherapy, will be taken after these results are available. Those who do require further treatment, our aim is to start this treatment within 6 weeks of the surgery. It's natural to feel nervous, but I want to reassure you that you will be in the hands of an experienced team who will be closely monitoring you throughout. Now, it's also important to talk about the risks. As with any major surgery, there are immediate risks which you should be aware of. These include bleeding, which might occasionally require a blood transfusion. However, with robotic surgery, we find that bleeding is usually very little and transfusion is rare. There is also a risk of infection, such as wound infection, urine infection, or chest infection. We take every precaution to minimize these risks, but they can still occur. Minor wound infections, especially at the belly button, can be a nuisance, and in most cases, routine antibiotics will address the problem. Another risk is accidental damage to surrounding organs. This is also not common, but can include injury to the bowel, bladder, ureter, or blood vessels. If this happens, we'll address it immediately during surgery, but once again, it may prolong your recovery. Occasionally, we have to abandon the robot and make a cut to repair the injury. The risk of this is low and probably less than 1%. Another serious risk is that of forming blood clots in your legs, which could dislodge and travel to the lungs. This is very serious if it happens, as it can cause sudden death. We will be very keen to prevent this using special stockings and daily blood thinning injections for 4 weeks. You or a relative will be taught how to administer these injections after you go home. However, the best method of preventing blood clots is by being mobile from an early stage. We will therefore be encouraging you to go on short daily walks after you've gone home. Cancer surgery, pelvic surgery, lung surgery are all strong risk factors for developing blood clots. That is why it is so crucial that you become mobile quickly. When you're admitted, and just prior to the operation, you will get a chance to meet the anesthetist. They will discuss your pain relief options after the surgery. Some anesthetists may offer you a spinal anesthetic injection, which lasts a few hours after surgery. However, there are many patients who do not even require this. I routinely use a lot of local anesthetic during the operation, and often this is quite adequate to provide the pain relief over the next 6 to 12 hours. Pain relief over the next few days will be through simple painkillers, which will be provided to you to take home. I know that this has been a lot to take in, but please don't hesitate to ask any questions. My goal is to make sure that you feel confident and supported as we move forward together. Amongst our team, there are dedicated senior specialist nurses who will introduce themselves to you and will be in constant touch with you immediately following your discharge from hospital. They will help you troubleshoot any problems that you may be encountering after your discharge. If you're having surgery under my care, then you will have an opportunity to meet me in person a few days prior to the operation or on the day of the surgery. You can ask me any questions that you feel you are still unclear about at that time. At this appointment, you may be asked to sign a consent form going over all that I've just mentioned in this video. Finally, I can assure you that we have a very dedicated team and we should be able to get you in and out of hospital quickly and get you back on the road to recovery and hopefully cured from this cancer. I shall look forward to meeting you in the future. Thank you.